Staff have been able to use video calls to help patients' recovery by making sure that we have regular contact with their relatives. This really helps with the motivation of the patients, and in fact I had a patient where we were actually able to video call their very first steps, which was really motivating for the patient and wonderful for the family and friends to see who were on the video call at the time. It's also helped with the mood of the patient as well. So we've noticed after we do the face-to-face video calls with relatives that the patient's mood has increased, and this helps with their participation within their therapy sessions as well.
We've been using video calls to keep family and friends in touch from all around the world. We've had patients talking to family members in Australia, Jamaica, South Africa. So it's been really wonderful to keep the families connected in these difficult times. It's also really wonderful to see the elderly who aren't so tech savvy being able to connect to their loved ones at home and things like that. So we set up video calls via contacting the family either the day before or just beforehand. We give them a meeting ID and a password, and we arrange a time and we meet them on there.
I think as an MDT on the stroke unit, we've really pulled together to ensure that patients have an opportunity to talk to their relatives and the whole MDT about the discharge planning process. On the stroke unit, we have regular case conferences with patients, and obviously these haven't been able to go ahead as usual, which are face-to-face meetings. So we've tried to emulate that with the use of video calls. And it helps to prepare for discharge because family have an opportunity to speak to every member of the MDT in the same space and ask any questions, and any worries that they have for discharge can be discussed at that meeting.
So I've learnt the importance of keeping families connected. It's been wonderful to see patients connecting with families from overseas and keeping them in touch.
On the stroke unit, we've learnt a lot about video conference calling over the last few months. I think what's important is knowing that it does take a lot of organisation, and you need some strategies in place to make sure that there's a fair amount of conference calling going on between the different patients on the ward. I think as well as sharing of knowledge, if someone's very competent at using video conference calling, sharing that knowledge with other members of the team so that there's equal opportunity across all disciplines to be able to do the video conference calling.